This presentation is going to be on preventing central venous catheter infections by Suzanne Holliday. Central venous catheters cover a wide range of different catheters, including PICCs, ports, there's Hickmans, there's perm caths, there's Hickmans, there's hemodialysis catheters. CVCs are being more widely used both in the hospital and as an outpatient, and the use of these CVCs are associated with very high risk of infection, which ultimately leads to an increase in patient morbidity, mortality, and a higher healthcare costs. Infection is the second leading cause of death in patients receiving hemodialysis, and the CVCs are the major risk factor for that bacteremia. There are many different ways that we can look at to approach the prevention of infection in the CVCs, and a few of those interventions will be discussed in the articles in this presentation today. I am currently working as a home health infusion nurse with Horizon Healthcare Services. Our job at Horizon as the nurse is to go out, teach the patient how to take care of their lines, to evaluate for infection, and to choose cleaning products, dressings, and those types of things that are best going to help the patient prevent infection in their line. The purpose of this project is to identify through research articles interventions that are available to reduce CVC infection. The PICO research question that's going to be discussed in this presentation is how can infection rates be reduced in patients requiring a central venous catheter? The P for population would be the people requiring the use of a CVC. The intervention are methods to prevent infection in CVCs, including cleaning solutions, dressing types, lock solutions, and patient education. Comparison, the studies are going to, some of them will use a control group or the national infection average compared to their intervention that they used in preventing CVC infection. The outcome or the goal is to decrease the amount of infection associated with CVCs. To locate articles relevant to the research topic of reducing infection rates in CVCs, this process was used. First, PA College Library site was utilized. The search was completed through the CIN AHL Complete. Results were then limited to full-text articles in a peer-reviewed academic journal. The articles were in English and published within the last 5 years. Subject headings included central venous catheter, infection, prevention, lock solutions, dressing types, and education. In the end, 5 articles were chosen on this topic. The reason they were chosen is because they were primary research articles. They each focused on different strategies in preventing CVC infections, and the researchers had used a quantitative research technique. The Barcelos and the Suwin articles both looked at different lock solutions that could be used in non-tunneled hemodialysis catheters. The one article compared the 30% trisodium citrate lock with a heparin lock, and the other article compared an ethanol lock with a normal saline lock. The Pages article was a primary research article as well. It used a quasi-experimental study to evaluate whether a chlorhexidine scrub or a providine iodized scrub while doing a CVC dressing change was more effective in preventing CVC infections. The Petroleus study was chosen because it looked at education. It specifically looked at cancer patients that had a new PICC line placed and were being required to flush their PICC line at home. The study was evaluating if the education that was provided on an electronic tablet and the use of FaceTime helped to prevent the infection in the CVC by providing better education. And then lastly, the Carpenium et al. Study was again a primary research article, and that one was used the comparative study design to compare the effectiveness of a 2% chlorhexidine gluconate gel dressing with a regular non-antimicrobial dressing. The literature search for this course proved to be more difficult than expected. It was challenging to find primary research articles on a specific topic, especially when they were required to be similar studies. It was a time-consuming process to ensure a quality article was found, But in the end, by taking the time to truly evaluate the researchers' techniques in the articles for quality research, the quality research articles were obtained for this project. The Barcelos and Seween articles both were looking at different types of lock solutions that could be used in the non-tunneled hemodialysis catheters. Both of the articles concluded that the lock solutions could not be proved effective in preventing infections in the non-tunneled hemodialysis catheters. The Pages study was the one that was studying the chlorhexidine scrub versus the providine iodine solution as a cleaning solution for the dressing changes, and concluded that the chlorhexidine scrub was more effective in preventing the CVC infections. The Petroleus article was the pilot study that was used to determine if the electronic tablet education for cancer patients that were newly learning to flush their PICC lines at home would be effective in decreasing CVC infections. The study did conclude that the electronic education was effective at both reducing complications and infections, as well as providing the quality education that the patient or caregiver needed when flushing their PICC line. The Karpenin and Associates article compared the use of a 2% CHG gel dressing with the regular non-antimicrobial dressings for a CVC dressing change, and did conclude that the 2% CHG gel dressings reduced the amount of microorganisms at the CVC insertion site and would be recommended for use. Each of these articles researched different techniques that are available to prevent CVC infections. From the articles that were chosen, research shows that the utilization of 2% CHG gel dressings and the chlorhexidine scrubs when cleaning the insertion site are proven effective in reducing CVC infections. It also showed that the use of the 30% trisodium citrate lock and the ethanol lock were not proven to be effective in decreasing infection in non-tunneled hemodialysis catheters, and it showed that the use of electronic education via tablets and FaceTimes needs to be researched more with a more random sampling and with a control group to truly say if it is a more effective form of education in the effort to reduce CVC infections. And that's because with that research article, it had a very small sampling, and it was not a random sampling, and concluded that since it was just a pilot study, more research needed to be done on the topic. To complete the literature synthesis, each article needed to be reviewed for the outcomes of the research, how the research was conducted, and also if the results were valid. Thoroughly reviewing the methods and limitation sections of the articles, along with the conclusion, gave a good interpretation of the results. After taking this course, the process of reading, interpreting, and evaluating a study has become clearer and easier. This is a skill that will be important to have in the nursing profession, as it is constantly changing due to new research and evidence-based practice recommendations. From the articles reviewed, a recommendation could be made to Horizon Healthcare Services. This recommendation would be to supplement its oral and written patient education with the additional option of electronic education. The Petroleus article states a major goal of nursing care is to promote positive patient outcomes by delivering infusion therapy free of complications. This is also the goal of nursing at Horizon Healthcare. As patients become more efficient on tablets and using applications, an electronic education program could help them and assist them in better understanding their PICC line care. This was outlined in the article as it stated throughout the article that some nursing teaching is inconsistent between the nurses and nursing agencies, and also that patients learn better on their own timing with a more visual teaching method and also in the comfort of their own home. Implementation of this recommendation could be done by nurses at Horizon Healthcare Services creating YouTube videos on proper techniques and steps on flushing CVCs. This type of video would supplement the already given oral and written instructions that is already provided to the patients. Potential issues with this implementation and recommendation would be if the patient has a lack of internet access or just does not have a device that could play videos on. And also, something to take into consideration is the cost of paying RNs to create the videos and the equipment that might need to be purchased to create good quality videos for this project. From this presentation, it can be concluded there are many aspects to consider in the efforts to prevent CVC infections. Research continues to find the best guidelines for physicians, nurses, and patients and their roles in preventing CVC infections, which only a few were discussed today. It is recommended that chlorhexidine scrubs be used for CVC insertion site cleaning, and that the 2% CHG gel dressing reduces microorganisms at the CVC insertion site. It was also found that the ethanol and 30% trisodium lock therapy could not be proven effective in preventing infection in hemodialysis catheters, and that ultimately more research needs to be conducted on providing educational resources on tablets for patients and how this affects the PICC infection rates. Here are the references from the articles that were discussed during the presentation.